Is there a connection between changes to your gut health and microbiome and weight gain and obesity? Hi, my name is Tal from the American Academy of Functional Health, and in this video I'm going to show you one out of the 5 major causes of weight gain and obesity that doctors don't talk about. So we know that weight gain and obesity is a worldwide problem. And according to the Washington Post, every year 45 million Americans try different diets. The problem is that when we cut back on calories, our metabolism tends to slow down, we lose muscle mass, and we burn fewer calories. We also know that diets are not a good long-term strategy for weight loss because they're short-lasting, require significant amount of investment of willpower, and to go through that struggle and then have your metabolism slow down is just very, very challenging for many of patients and people who have been struggling with weight gain and metabolic issues. We also know statistically, according to the CDC, that in the US about 7 out of 10 adults struggle with excess weight, among them 4 out of 10 with obesity. So in the functional medicine approach, we understand that there is a different way to address obesity and weight gain. Recently published studies have reported that weight gain is the result of internal changes in our metabolism caused by 5 major factors rather than a change in the exercise or number of calories that we eat. Unfortunately, this topic, the root cause approach, is not taught in medical schools and is not addressed by healthcare practitioners in the conventional medical approach. The result is many patients continue to struggle with excess weight and obesity. So today, we're going to talk about one out of those 5 or 6 major factors that can contribute to weight gain. And this is gut health, microbiome, and function. So in our gut, we have about 100 trillion bacteria that are living in our gut, which is about 10 times the number of cells in our body. Now, there are anything between 300 to thousands of different species of bacteria that are living inside our gut. And it's a massive ecosystem, and one thing that is important to understand is that they're not all the same. Different species of bacteria have different functions. In the same way that in our defenses forces and community services, we have different professionals. We have a fireman, which is called when there's a fire, right? There are police officers that are called when there's a home invasion or some sort of civil disruption, right? And then there's the military soldiers, which are called to defend our borders, right? And so in the same way, the gut bacteria, different species have different beneficial properties to them. However, changes to the gut microbiome were reported to be associated with overweight or inability to lose weight. For example, small intestine bacterial overgrowth, which we refer to as SIBO, can vary from person to person, but essentially describe a situation in which there is an overgrowth of a certain bacteria that could be pathogenic or dysbiosis, and that changes our metabolism. And so gut bacteria, as we mentioned, play a role in our metabolism. Dysbiosis plays a significant role in metabolic conditions and weight gain. Dysbiosis is described as a disruption to the microbiome, which results in an imbalance in the diversity of gut microbiome. So essentially, in our ecosystem, you can have a situation due to multiple reasons or factors in which you suddenly lose some of the beneficial bacteria and have overgrowth of dysbiotic or imbalance or pathogenic bacteria, and that can shift your metabolism. There are multiple factors, as I mentioned, that can contribute to dysbiosis. For example, antibiotics might harm the beneficial bacteria and allow harmful bacteria to grow or overgrow and might contribute to obesity. Now in this picture, on the left side, you can see an illustration of several mechanisms that show us how the gut microbiome are associated with weight gain and metabolic disorders. In a healthy individuals, which you see in the picture on the left side, there's a higher diversity of gut microbiome, which typically means a higher secretion of important metabolites, such as short-chain fatty acids. However, lower diversity of the beneficial bacteria or overgrowth of certain pathogenic or dysbiotic bacteria species was reported to be associated with an increased sensation of hunger, increase in systemic inflammation, increase in our permeability of our gut, and accumulation of fat and increase in insulin resistance. All of those factors that I just mentioned can contribute not just to overweight or obesity, but it is also one of the major reasons why these individuals have significant increased risk of cardiovascular diseases, diabetes, atherosclerosis, liver diseases, and other cardiovascular issues. Here's an example of a comprehensive stool test that can analyze the different bacteria in our stool. It gives us an indication, an idea of what's happening in the patient's gut. So you can see here, this is from a 60-year-old patient with weight gain and joint pain. This patient was taking pain medications, supplements, and probiotics out of an continuous attempt to try to address those issues. And as you can see in this lab testing, we do have a really nice amount of expected or beneficial bacteria. The range goes from +1 to +4. But you can also see that we also have imbalanced bacteria or dysbiotic, such as Klebsiella. So there are multiple studies that have come out showing us a strong association between the changes that we might experience in our gut ecosystem and obesity and overweight. And this, for example, study that was published in 2017 reported that there's the first human study that demonstrated that obesity is inversely related to SIBO, the small intestine bacterial overgrowth. And there was another interesting report in children that small intestine bacterial overgrowth is extremely common in overweight and obese children and was found not only in severe obese subjects but also in moderately overweight patients. About 72 to 75% of overweight or obese children had some sort of dysbiosis or small intestinal bacterial overgrowth. And so the clinical manifestation of SIBO can vary and range from asymptomatic illness or mild and non-specific intestinal symptoms, all the way to that could be bloating, that could be gas, that could also be other symptoms that are non-GI related. Here's another interesting study that reported that the gut microbiome can influence glucose metabolism and host hormone regulation by producing various metabolites such as short-chain fatty acid. We dive deeper into these multiple mechanisms and how changes in our gut microbiome can contribute to sensation of hunger, the regulation of hormones, and then all these different metabolites that can help us with improve our body weight. And when it comes to obesity and metabolic conditions, we want to have a deep understanding of the gut microbiome. So if you're working with patients that have metabolic challenges, that have body weight challenges, then we definitely want to go deeper on the gut microbiome and gut function and gut integrity. But we also want to remember that the microbiome impacts the brain through the metabolites that these bacteria secrete into our systemic circulation and through stimulating the vagus nerve. This is what we refer to as the gut-brain axis. Now, if you only address your patient's gut dysfunction or try to induce calorie restriction or exercise, but you do not address the dysfunction, the underlying dysfunction, either the gut microbiome or the gut-brain axis, then it will be harder for them to lose the excess weight. And guess what happens once they stop the diet or they reduce the level of exercise? That weight is gonna come back, sometimes with interest. So we always recommend to understand and address the underlying condition that contributes to this metabolic dysfunction. And we know another interesting mechanism that we talk about during the Functional Weight Loss Summit is that the gut microbiome and its metabolites not just impact the brain, but it also impact our endocrine system, like the thyroid. We know that the thyroid is so important for regulating our basal metabolic rate, which means, in simple terms, the thyroid helps to regulate how much calories we're burning at rest. And so there is a strong relationship between dysbiosis and thyroid dysfunction. Reduction, for example, reduction in the beneficial bacteria levels reduces the amount of short-chain fatty acid that those bacteria produce, which might increase inflammatory pathways and reduces mineral absorption, which is needed for healthy thyroid function and production of thyroid hormones. On the other hand, we're seeing that dysfunction of the thyroid can lead to deficiency of the thyroid hormone, which could lead to several issues such as slower bowel movements or constipation, reduction in stomach acid or bile, which would contribute to dysbiosis, the overgrowth of those bacteria. So we have to have an understanding and look at the whole picture to really help those patients from a functional and nutritional and integrative medicine approach. And so in this mini class, we have talked about how changes in the gut could lead to or contribute to weight gain. And I've talked probably about 2 or 3 of those mechanisms that explain to us that connection between our gut and our metabolism. Remember that there are multiple major factors that can contribute to weight gain. And of course, we have to remember the clinical application of probiotics. And this is not referring to the general probiotics that patients are buying in the stores. This is professional or medical grade based on evidence, based on human clinical trials. So in the Functional Weight Loss Summit, we're going to discuss the top 2 or 3 probiotics that were found to reduce body weight without counting calories and without exercising. This is something that we're going to discuss in much more depth, and I'll show you the interesting clinical trials in which specific probiotics products are going to be beneficial for your patients. In this Functional Medicine Weight Loss Summit, you're going to dive deeper into the 5 physiological factors that lead to weight gain in the functional medicine approach, the use of functional or specialty laboratory testing to identify the dysfunction, and how to create a personalized treatment plan and support healthier metabolism. So we have multiple experts that are teaching weight loss from a functional and integrative medicine approach. So if you're interested in learning more about the root causes of weight gain and obesity and metabolic dysfunction, more about the specific lab testing, the treatment protocols, and how to help your community to improve their health and wellness, then I invite you to get a ticket for this Functional Weight Loss Summit. The event is live. You can ask questions, you can engage with us. You'll get access to the recordings as well, and the clinical handouts and guides for you to use with your patients. And so I invite you to click on the link below and secure your ticket. I'll see you there.